Hey everyone, my name is Jeff Wang, and I'm a member at Antioch Community Church in Fullerton. I'm also an infectious disease doctor practicing in North Orange County. Mark asked me to share some information about COVID-19 because we believe that good information can be powerful. So COVID-19 is the disease that is caused by the novel coronavirus that emerged out of Wuhan, China in late 2019. It has now spread to all corners of the globe and is considered by the World Health Organization a global pandemic. COVID-19 is primarily transmitted through respiratory droplets, such as coughing and sneezing. It can also be transmitted with contact from contaminated surfaces. The most common initial symptoms are fever, cough, sore throat, and fatigue. From the data that we currently have, around 80% of people who contract COVID-19 will likely recover without having to be hospitalized. We know that younger age tends to be protective, and thankfully children seem to be the most protected. However, in around 20% of patients, COVID-19 can cause a pneumonia-like illness severe enough to warrant hospitalization. In around 5% of patients, the illness is severe enough to warrant intensive care unit care, including mechanical ventilation. The overall death rate of COVID-19 is not yet known and will not probably be known until the disease has run its course, but it's estimated to be anywhere from around 1 to 3%. Just for reference, the flu kills about 0.1% of people who get it. So COVID-19 is anywhere from 10 to 30 times more lethal than the flu. The important concept to understand about COVID-19 is that severe illness and death is heavily weighted towards those who are older and who have pre-existing medical conditions. Don't get me wrong, young people can get really sick too. There's actually a young mother in the hospital I work at now with COVID-19. There's also a man in his 30s from LA County who died yesterday from COVID-19. However, the data does show that around 20% of people age 80 or older will die if they contract COVID-19. It's also important to know that COVID-19 is here. People from Orange County are getting sick from this disease, and they are in our hospitals now. So most of us know that our government and public health authorities are going full in on social distancing. Governor Newsom announced last night that Californians need to stay home as much as possible. Everything is canceled. This response is meant to do two things. Number one, it's meant to protect our most vulnerable populations. The idea is if enough people stay away from each other, transmission will slow down enough that many of our older citizens and those with pre-existing conditions will be spared. Number two is meant to prevent a surge of sick patients from overwhelming our medical facilities. This has happened in other countries. Italy's hospitals have been completely overrun, and it can happen to us too. If we slow down the rate of transmission, we give our hospitals a fighting chance. So people often ask me as an infectious disease doctor if I am afraid of COVID-19. I tell people that I'm not afraid, but it's not because COVID-19 doesn't need to be taken seriously. This is the public health issue of our generation. I'm not afraid because a deeper and deadlier infection of mine has already been healed. At one point, I was wretched and separated from God, but 2,000 years ago, God became flesh, and he who knew no sin became sin on my behalf so that I might become the righteousness of God. It is now more important than ever to ground ourselves in the gospel of grace. The gospel keeps us from two wrong reactions we can have in the wake of COVID-19. Number one, the gospel keeps us from living in fear and anxiety. Our Father loves us so much. Even at our worst, he saw us to the bottom, yet loved us to the top. Let that truth sink in and anchor your soul. What is a pandemic compared to that? Do not fear. But the gospel also keeps us from living in denial of COVID-19. and that we can just go about our daily lives as if normal, even if we happen to be younger and less susceptible to COVID-19. When I reflect on this God who incredibly loved me when I was so broken and poor in spirit, I get a glimpse of his heart of compassion for those who will suffer most in this pandemic. Social distancing is hard. Some of us have lost jobs. Many of us will feel our mental health decline. But Jesus died a hard death for me. God will grant us the strength to do a hard thing to protect those he loves. All right, that's all I got. Wash your hands, cover your coughs, stay at home as much as possible, and support each other as much as you can. Go out there and be the church.